Hi, everyone. Thanks for coming to my presentation. This is regarding the topic of adverse childhood experiences, or ACEs as abbreviation, as we've learned in the textbook, and its implications. My name is Jacqueline Zavala. Let's begin. ACEs are abbreviation, like I just said, for adverse childhood experiences. And a study done by the CDC, the Center for Disease Control, in 2026 defines ACEs as potentially traumatic events that can occur during childhood years, basically when a child is born to 17 years of age. And these can include experiences with violence, abuse, or neglect, seeing violence occur in one's home or community, having somebody in the family attempt suicide or die by suicide. In addition, children growing up in an environment with the following situations can also lead to having increased number of ACEs. This includes substance abuse, families with mental health illnesses or problems, parental divorce or separation, or family members that are incarcerated either in jail or prison. Some of the effects of ACEs: a study done by Bayer and Lazara in 2020 explained how children suffering through ACEs can be preoccupied with their own actions during the event. They often feel guilt or shame over what they did, or lack thereof, during the traumatic event. And because of this, they might also engage in a constant retelling of the traumatic event or describe being extremely overwhelmed by their feelings of fear and sadness. Another study by Bayer in 2020 mentions that these children may also have the following symptoms. These can include sleep disturbances, such as difficulty falling asleep, insomnia, fear of falling asleep alone, or increased frequency of nightmares. And teachers have also noted that these children have trouble concentrating and learning in school. They might also have headaches or stomach aches without an obvious cause, or also exhibit reckless and aggressive behaviors. And some of the facts and stats about ACEs: these adverse childhood experiences are actually a lot more common than we would think. About 75% of high schoolers have at least one traumatic event, with more than 20% having more than 4 events happen during those childhood years. And the most common ACEs are emotional abuse, physical abuse, and households with mental health illnesses or substance abuse. Now, the good thing is preventing ACEs could actually lower suicide rates by 89%. A lot of these children, as they grow and they experience these ACEs, are left with very traumatized minds, and that actually affects them because they'll pursue prescription opioid abuse. So if we lower ACEs, we can reduce that opioid prescription abuse by 84%. We can also lower rates of depression and hopelessness in high schoolers. And overall, this would lead to lower chronic diseases in adulthood. Some of the psychological impacts: ACEs can have permanent effects on a person's health, and this follows them into adulthood. Some of the risks involved are increased chances of injury, sexually transmitted illnesses, and involvement in sex trafficking. A study done in 2021 by Gurman discusses how ACEs can affect a person's optimal health and development because it alters gene expression, brain connectivity, and function, as well as immune system function and organ functioning. This compromises the development of healthy coping strategies, and other chronic illnesses will result in it, including stroke, asthma, lung disease, cancer, artery disease, diabetes, and depression. ACEs have also been associated with increased rates of obesity, physical inactivity, and high-risk sex behaviors. ACEs and their link to health risk behaviors and adult diseases. Felitti and al. In 1998 showed behaviors like smoking, alcohol or drug abuse, overeating, or sexual behaviors that may be consciously or unconsciously used due to the immediate pharmacological or psychological benefits as coping mechanisms. ACEs can cause anxiety, anger, and depression in children, so these mechanisms are used to cope chronically. And the following image right here of the pyramid shows how ACEs can lead to disease, disability, and social problems which can greatly increase the chances of an early death happening. Now, the good news is there's lots of treatment approaches. The Center on the Developing Child at Harvard University released an article in 2007 recommending early intervention is imperative to preventing the consequences of ACEs. A study showed that when the same children who experienced extreme neglect were placed in responsive foster care families before the age of 2, their IQs increased more substantially and their brain activity and attachment relationships were more likely to become normal compared to after 2 years old. The CDC in 2026 also recommended creating safe, stable, nurturing relationships and environments for all children to help them reach their full potential. These are essential to creating positive childhood experiences and preventing ACEs. Now let's talk about some of the risk and protective factors. The CDC in 2024 did compile a list. Some of the risk factors which increase the chance of ACEs are families with caregiving difficulties, low-income families, young or single parents, those with low levels of education, or those with isolated or poor community ties. In addition, children who don't feel close to their parents, who don't share their feelings, who start dating early or engaging in sexual activity at an early age, with few or little to no friends, are also at risk. In addition, communities with high rates of violence, crime, unemployment, poverty, and limited economic and educational opportunities also greatly increase these risk factors. The protective factors, those that decrease chances of ACEs, are families with safe, stable, and nurturing relationships, meet basic needs of food, shelter, and health for their children, steady employment, and also those with college degrees or higher education. Children who do well in school, have positive friendships, and peer connections also are at a lower risk. In addition, communities with access to economical and financial help, as well as ones in which residents feel connected to each other and their community, can also lower ACEs. The CDC also recommends the following methods for prevention. Parents can talk to their kids about their mental health and give support whenever necessary. Help their children learn to identify and deal with their emotions, and also be on the lookout for red flags such as anger, withdrawal, changes in school, and sleeping and eating habits that change. Please get help if needed. Everyone else can support these families by helping the families with childcare and promoting healthy eating habits, promoting policies for good work-life balance, as well as adopting nonviolent attitudes, beliefs, and to model this type of behavior whenever possible. Thank you very much, and the following are just all my resources.